Good afternoon. Uh, Myself, Dr. Parvinder Kaur Lubana, working as veterinary officer in North Regional Disease Diagnostic Laboratory, Jalandhar. My today's topic of discussion is Haemoprotozoan of dairy animals. Uh, dairy animal, mostly the crossbred cows and exotic animals and buffalo population are the sufferer of this group of protozoan. Uh, as we all know, the protozoan are of two type. Haemoprotozoan are of two type. Number one is intraerythrocytic, comprising of Anaplasma, Babesia and Thaleria, and extraerythrocytic, that is trypanosomes. On the basis of clinical science, all these parasites are differentiated very clearly, and clinical, when we clinically differentiate them, and then we are able to uh, able to collect the right sample. So, on the basis of clinical science, first, as we all know, that in all haemoprotozoan there is high fever. Number one, there is high fever, then there is anemia, and then another sign is tick infestation. And first of all, we should differentiate the fever. Fever, it is fever due to some bacterial diseases, or due to protozoan, or due to external this atmosphere or atmospheric temperature, that is fever due to basically known as hyperthermia. When we, in case of, first of all, we discuss Anaplasma, side by side Thaleria, then Babesia and Trypanosome. Clinically, in case of Anaplasma and Thaleria, when a cow is presented to clinics, when a cow walks to you for examination, and due to that little bit exertion, uh, cow is not able to breathe properly, and when we examine the cow is in the cow there is open mouth breathing, and the eyes are pale yellow, the conjunctiva of eye is pale, and animal is having fever, and there is little bit coughing also, and there is history of constipated feces coated with mucus, and another sign is there is staggering gait, and another most important sign is rapid bound pulse. And one most important clinical sign is recurrent fever. There is history of fever, either there is fever in morning or in the evening. And on the other hand side, when an animal is presented to you having diarrhea, in feces there is blood spots or blood clots, and animal is not able to breathe properly when it is in ease, or in standing condition, or when animal is sitting. This difficult respiration is due to cystic lymph node present in between the lungs, that is mediastinal lymph node. And there is lymphadenitis. In small animal there is lacrimation, there is inflammation of parotid lymph node, and followed by corneal opacity and high fever, and in feces there is blood. But in case of cow, there is lymphadenitis, the prescapular and prefemoral lymph nodes are swollen. And no doubt there is tick infestation also. And on a, and another in case of babesia, when we are suspecting babesia, we all know there is coffee color, urine, high fever, there is weakness, there is recumbency, animal is very pale, like due to heavy blood loss. And another sign, another protozoan, that is trypanosomiasis, there is very clear sign. Number one is gazing of eyes, another is ptosis of upper lid, then there is erect hairs, another is head pressing, circling movements, and there is loss of hairs from switch of tail. Another sign is hidebound condition. uh, and mostly and in one another sign is in case of buffalo, there is corneal opacity, by unilateral or bilateral in case of trypanosomes. And after seeing all these signs, a clinician or a veterinarian uh, must be able to collect a correct sample. And when there is in case of anaplasma and thaleria, we should collect blood, that is, we should always collect a blood in EDTA vacutainer. The quantity should be 2 ml, and we should mix the blood at that time. It is very good if we are able to stain the slide at that time with fresh blood. Just stain, just make a smear and fix it and send to the lab. And when we are suspecting thaleria, one another sign is when there is only lymphadenitis and there is no fever, and there is diarrhea, lymphadenitis and there is diarrhea, and at that time the right sample is lymph node aspirate. And we all knew how to collect lymph node aspirate. Just hold the lymph node like the prescapular lymph node, just hold and inject 5 ml of PBS or 5 ml of normal saline, and never withdraw the needle. Just hold the lymph node and massage the node properly from all the sides. Press and massage the lymph node, and try to retract back the material which we injected already, that is lymph node aspirate. If we have slides and methanol, then make a smear and fix it. If we don't have, then put a cap on the syringe at the needle part and send that material to the laboratory for examination. And also collect blood, 2 ml of blood for CBC. From that blood part, we are able to estimate the hemoglobin and the WBC. What is the exact distribution of the WBCs, like or we are able to basically that blood will help us whether there is lymphocytosis, what is the exact condition of the lymphocytes, Cox blue bodies. We are able to judge when we make a smear. There is a lot of Cox blue bodies having shy joints, and at that time the result is shy jointal form of thaliariasis, and the treatment is very everyone knew the schizontalcidal drugs. And in case of anaplasma, just collect blood and send a proper history that animal is having rapid bounding pulse or very anemic or difficult respiration, and then another sign is constipation or intestinal due to intestinal stasis. Then we are able to make a decision or conclusion whether it is anaplasmosis or it is thaliariosis. And in case of babesiosis, just collect 2 ml of blood, and when we and side by side give a first aid also to the animal, because the animal is very weak when there is babesiosis. Try to give some supportive therapy. And in case of trypanosomiasis, while collecting sample, first inject some sugar solution like dextrose saline or Rintos. And the reason is the trypanosomes migrate to inner circulation. When we give this sugar solution like Rintos or glucose or dextrose saline, it comes in peripheral circulation, and we are able to collect the right sample. After injecting, after giving intravenously 2-3 bottles of 2-3 liters of this saline, this dextrose saline, after half an hour collect the sample and try to make thin and thick smear on the spot. And after drying it or in case of thick smears, after take a slide and put a 25 paisa coin drop on a slide, dry it, and after drying, dip the slide in a beaker or containing water, and then all the RBCs or hemoglobin drains out, like it is known, the process is known as dehemoglobinization. And on the slide there is a gelatin like material containing WBCs, and if there are some protozoan, those also present on the slide. And fix it, dry it, fix it, and send it to the lab, and we are able to diagnose the slide rightly, correctly. And now the sample on the basis of clinical signs and on the basis of laboratory diagnosis, that this the result of CBC in all haemoprotozoan diseases, the CBC or the DLC, DLC picture, differential diagnosis, different type of leukocytes, the picture changes. Like there is in all haemoprotozoan, there is a change there, and there is lymphocytosis and there is eosinophilia. Except in case of anaplasmosis, there is neutrophilia, because it's a bacterial disease, it's a rickettsia. The anaplasmas are rickettsia. There is more number of neutrophils. Now, after seeing the laboratory report, which clearly, in case of anaplasma, there is very poor condition of RBCs. There is carnations on the margins of RBCs, not proper shape of RBCs, having solid dot on the margin, and that is anaplasma marginal. And in case of thalaria, when in early stage there is lymphoblast containing Schizonts, known as Cox blue bodies. And in case of thalaria, when there is pyroplasmosis, the RBCs containing comma shape, that is the thalaria parva, or rods or signet shape rings, Basically, thalerias are pleomorphic, rods, dots, signet rings, and all that. And in case of Babesia, the two pear shape organism, two pear shape like Babesia bigemina, joined at acute angle, known as Babesia bigemina. Uh, very clear picture. And in case of trypanosomes are filamentous bodies having central nucleus, should not confuse with flagellate platelets. Platelets are always in groups, but protozoans are 1, 2, 3 separated at different places. This is the picture of Haemoprotozoan under microscope. After looking at this and the CBC and the clinical sign, we are able to clearly diagnose. We are able to diagnose very clearly which protozoan is this: Anaplasma, Babesia, Thaleria, or Trips. Now, treatment we all knew. My request or my suggestion to my veterinarian colleagues: never treat animals having high fever or anemia without laboratory diagnosis. Laboratory diagnosis helps a lot to the veterinarian, to treat animal very accurately, and in few doses of medicine the animal revives its condition. And now the the second part is control, treatment after treatment, and the last part is control of this Haemoprotozoan. As we all knew, and that the vectors are the major culprit of this diseases, of the spread of these diseases. So we are to control the vectors like ticks. As we all knew that 20% ticks reside only on the animal body, and rest 80% are present on the in the sheds, in the floor, on the floor, and we are to treat on the animal judiciously using acaricides, applying or spraying or dipping. And we are also to advise the farmer to treat the ticks present on the floors by burning the floor with hot air, or by spraying with biodegradable acaricides like cypercare, cypermethrin, amatraj, like acetol type of. And we are also to advise the farmer that spray twice in a week turpentine oil on stagnant water outside the sheds. It helps to kill the younger stages of flies and mosquitoes, and hence we are helping the spread of the Haemoprotozoan, like Haemoprotozoan like trips. Trips are basically these flies, the Lucilia, these tapered flies. These flies spread the trypanosomiasis from one animal to another, and it is very effective treatment of controlling the flies in these days. I think now we are helping rightly to the farmers by using this pattern of diagnosis, like clinical signs and laboratory diagnosis and ticks control. Thank you very much.